Diabetes, also known as diabetes mellitus, is a condition that affects insulin. And for those who don't know insulin, insulin is a hormone that breaks down sugars in your food and then converts them into glucose to fuel up the body. What is diabetes? Diabetes occurs when your body does not process food as energy properly. So insulin is a critical hormone that gets glucose to the cells in your body. So here when we talk about glucose, I mean the sugar that is used as energy. So when you have diabetes, your body either doesn't respond to insulin or doesn't produce insulin at all. So this causes the sugars to build up in your blood, which puts your body at risk of dangerous complications. Types of diabetes. So diabetes can be classified as type 1, type 2, or gestational. Let's first talk about type 1 diabetes. So type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the cells in the body that produce insulin. So the rate of type 1 diabetes is rising worldwide, with the greatest increase occurring in children younger than age 5. So in people with type 1 diabetes, the body does not make enough of the hormone insulin, which enables the body to convert glucose into energy. Type 1 diabetes develops when the insulin-producing beta cells in the pancreas are destroyed due to an autoimmune process in which the body's immune system mistakenly destroys its own organs. So the onset of symptoms can happen quickly, whereby people who have diabetes type 1 may need daily insulin shots. Now let's talk about type 2 diabetes. So type 2 diabetes is a metabolic disorder that results from the body's inability to make enough insulin or to properly use the insulin. So type 2 diabetes is the most common type of diabetes whereby the pancreas produces enough insulin but the body cannot use it effectively. So this is referred to as insulin resistance. Now let's talk about gestational diabetes. So gestational diabetes develops during pregnancy when a hormone made by the placenta prevents the mother's body from using insulin effectively. So gestational diabetes is not caused by lack of insulin but by other hormones produced during pregnancy that can make insulin less effective. So gestational diabetes symptoms disappear after delivery of the baby. So today let's talk about pre-diabetes. So in pre-diabetes, the blood sugar level is elevated but not to a degree that constitutes diabetes. So people who have repeated tests showing elevated fasting glucose have increased rate of developing full-blown diabetes. So people who are over 45 years should be tested for pre-diabetes or diabetes. So in most cases, if the first blood glucose test is normal, individuals should be tested every 3 years. So if you're under the age of 45 years, you should consider a test of pre-diabetes or diabetes. In most cases, if your body mass index is greater than or equal to 25. You have several risk factors such as sedimentary lifestyle, taking certain medications, including antipsychotics, steroids, diuretics, or having family history of the disease. Symptoms of diabetes. Depending on the type here, diabetes can cause too much or too little glucose in blood. Number 1, hyperglycemia, also known as high blood sugar. Diabetes is characterized by a failure to secrete enough insulin. So for those who don't know, insulin is a hormone produced in the pancreas and it is needed by the body to convert glucose into energy. So without adequate insulin, abnormally high levels of glucose can accumulate in the blood. Number 2, hypoglycemia, also known as low blood sugar. So hypoglycemia is characterized by a blood sugar level that is too low to fuel up the body's normal functioning. So hypoglycemia may be a condition itself, a complication of diabetes, or a sign of another disorder. Problems with blood sugar regulations due to diabetes can cause headache, increased thirst, frequent urination, increased appetite, weight loss, blood vision, fatigue, and dry mouth. So if your child develops any of the above symptoms, you should consult a pediatrician immediately. So even though type 1 diabetes may take years to develop, the onset of the symptoms are fairly sudden and rapid. So if a person has undiagnosed and untreated type 1 diabetes, they can go into a life-threatening diabetic coma called ketoacidosis. So symptoms of type 2 diabetes are the same as type 1 diabetes. But unlike type 1 diabetes, symptoms tend to develop slowly. Diabetes diagnosis. Number 1, random blood sugar test. So this is taken anytime regardless of how recently you have eaten. Number 2, fasting blood sugar test. So this measures the blood sugar levels after you have not eaten overnight. Number 3, glucose tolerance test. So this takes blood sugar levels over the course of several hours to show how quickly your body metabolizes the glucose in a special liquid you drink. Number 4, glycated hemoglobin test, also known as A1C test. So this assesses blood sugar levels over several months. The treatment of diabetes depends on its time and severity. The treatment of diabetes includes frequent blood glucose checking to monitor blood glucose levels. Yeah? You can also talk about lifestyle changes, including diet and exercise. You can also talk about oral medication and also daily insulin injections. So you should remember that regular exams are crucial for people with any type of diabetes. So this helps to monitor and treat any arising complications such as eye problems, kidney diseases, and cardiovascular diseases. And also talk about neuropathy, I mean the damage of the nerves. So thank you very much. I'm Muji. Please follow me up, like my videos, and please share.